Hi there, I'm Elaine, the pharmacy technician in charge of this lab. I have just walked into the ante room and I am not trying to cross over the line of demarcation. You have just witnessed and viewed the poster of which are Chapter 797 guidelines for garbing and hand washing. And that is the procedure that we use in this lab. And this is what the video is going to demonstrate, is proper garbing and hand washing so that when you step into the sterile room, you'll be all ready to go. And then the following videos that you see will be in the sterile room and working within the laminar air fluid. So I'm just going to get started. I'm going to put on 3 pieces of my garb on this side of the line of demarcation. I'm going to put on my cap or bonnet, I'm going to put on my mask, and then my shoe covers. Cap is very simple. Put over your head. Make sure all your hair is tucked in. I've already removed all my jewelry. I have no jewelry, no earrings, no watches, bracelets, anything like that, so nothing to obstruct. I'm going to put on my mask. This is a procedural mask. It has a wire at the top of the mask which will fit over top of my nose. And you can just pull that down just like that and make sure your cap. So now my face is completely covered. You can wear eyeglasses in the sterile room. So when you have your eyeglasses on, you may notice some fogging. And so you just have to adjust your mask. And you'll see that when you come into the lab. So the last piece of garbing that I'm going to put on before I cross over the line of demarcation are my shoe covers. So the shoe covers are a single pair. You're going to put on one shoe cover and not step on the dirty side of the line of demarcation. You're going to put on one shoe cover. If you have to lean against the door, you can. So I put on one, and now I can cross over to the clean side of the line of demarcation. And then I'll put on the other shoe cover, and then step and keeping my balance on the clean side. So now, if I forgot something on the other side, I cannot take my clean shoe covers over to the dirty side. So now I'm going to do my hand washing. So as I said, I've removed all my jewelry. This is a sensored sink. So if I wave my hand in front of the sensor, it will run the water. So it's basically a touchless sink, which is great. So the first thing I'm going to do is do a thorough rinse of my hands down to my arms. So just approach the sink, and all I'm going to do is run the water, probably put my opposite hand in front of the sensor, and let the water run down my arm. And then put the other opposite hand and let the water run down my arm. And you can let it run down a little bit. I'm going to grab a little bit of soap, just a little bit, not too much. I'm going to create a lather. Just going to create a lather. I'm not washing at this point. And I'm going to take my one hand and I'm going to wash my forearm down to my wrist and stop there. Take my other hand, wash my forearm down to my wrist. So you want to wash your arms first. So those are washed, and now I'm going to do a thorough scrub of my hands. So that includes my palms, the backs of my hand, the side of my hand, in between my thumb and forefinger, interlacing the fingers, and then finally my nail beds. So this should really, realistically, take about a minute. I want to do a thorough scrub. So everything's been washed down, and now I want to rinse. So the important thing about rinsing is it's the same direction. I want water to run down my hand, down to my arm. If I rinse from my arm down to my hand, then everything dirty from my arm is now coming onto my hand. Whereas realistically, I want everything dirty from my hand to run down my arm. So all I'm going to do is activate the sensor and rinse. It's the exact same thing that I did when I wet my hands with PHARM. You can go in again. And you notice that I'm not doing this. Do not do this. I'm rinsing my hand down my arm and pulling it away. So if I do the other hand, I'm rinsing my hand down to my arm and pulling it away. I can repeat. Rinse my hand down to my arm, pulling it away. And then if I want to do it one more time, I can. So I'm done rinsing. I'm now just going to let the water run down my elbow. Just picture it as a surgeon. They've done a full scrub. They don't want to contaminate their hands. They want the water to run down their arm. And so now I'm ready to dry. So you're going to grab a set of paper towels. You have to grab enough to say that you can thoroughly dry yourself. And you're going to dry one side, starting at your hand, because this is your cleanest. You cannot dry your arm and then take that same paper towel and touch your hand. You have to dry your hand, then dry your forearm, and then this is garbage. Another set for the other side. Brand new set of paper towels. Dry my hand down to my forearm and thoroughly dry. And then if I feel I'm not dry yet, I can take another set. I can repeat it, but again, it's a separate piece of paper towel for each side. And that is garbage. And so now I'm dry. So the last piece of the garbing is that I want to put on my outer gown. So I have a yellow isolation gown here. So we'll be wearing the yellow isolation gowns. Very simple. Just put your arm through. It ties at the back. And then it ties at the waist. So as you're watching this video, you should already have thought to yourself, she's just scrubbed her hands and she's put them through this gown, which is not sterile. So realistically, according to the Chapter 797 poster, it does say that you can re-scrub your hands, or you can use a hand sanitizer before putting on your gloves. And that's what we're going to do. We're going to put on a little bit of hand sanitizer, just a tiny bit, basically just to decontaminate our hands before we actually put on our gloves. Make sure it's thoroughly worked in, because you actually won't be able to get the gloves on if you don't. And then we're just using procedural gloves. We are not using sterile gloves in this lab, but most IV rooms do use 100% sterile gloves. So you're going to take your glove and you're going to put it over the cuff of your gown. And then as I walk this way, I will not push the door with my hand. I'm actually going to either use my arm or push back to open the door. Do not touch the door with your hands. So you can approach the door, and once you're in the sterile room, then we'll be touching base with any new additions that we need to finish for Garbing. Thank you.